Sexologists from Samadhan Health Studio bring to you a refreshing podcast, MyDoctorTells. Here you will find solution to all common sex problems directly from the experts. Know about vaginismus, unconsummated sex, erectile dysfunction, premature ejaculation, masturbation addiction, nightfall, and truths about several sexual myths. I am Dr. Ashok Koparday in association with Dr. Hetal Gosalia, and we have made all of this and much more available to you all for free. No strings attached, no sign-ups, no email IDs required at MyDoctorTells.com. Today, I'd like to talk to you about a condition called as premature ejaculation. We prefer to call this as EOR, early orgasmic response. It is also called as IELT, intravaginal ejaculatory latency time. Let me call this as PE, and what I hope is that a significant number of people who are listening to this will be relieved to know that they are actually not suffering from premature ejaculation, so they don't have to walk to a doctor's office. Another significant number of people, and I really mean a huge number of people, will come to know how to get over this and improve upon this condition, which is commonly termed as premature ejaculation. So, a simple question: what is premature ejaculation? Like, what is mature ejaculation? What is premature ejaculation? Is there something like a standard fixed time? So let me tell this at the outset that the normal time for ejaculation from the point of entry of the penis into the vagina to the time of ejaculation, that is discharge of semen, that time is 60 seconds to 180 seconds. Did you hear me? The normal time is 1 minute to 3 minutes. Now, in the same individual, the time can sometimes be lesser than a minute. In the same individual, at some times, the time can be more than 3 minutes. So this is about what it is. Why I have to tell this normal time is because most of the people who are listening to this have their notions which are coming from watching pornography. In pornography, you may be amazed to see that he's doing it for 5 minutes, 10 minutes with one lady, another 10 minutes with another lady, another 15 minutes with the third partner. And a sincere, sensitive person who has self-doubt labels himself as premature ejaculation, thinking that, oh my God, if that is what people do, I'm nowhere. So that is the primary input that most people get about their sexual functioning, the sex physiology, the timing and everything. So it is never 30 minutes and 40 minutes and whatever is shown in pornography, so that most intelligent people will be aware that it's for entertainment, not pornography is not for sex education. Now, in case the person ejaculates within a minute or even before insertion, so he is doing foreplay and he ejaculates, so there's no way he can insert. So these are the cases, typical cases, classical cases, which go to the doctor for treatment of premature ejaculation. So if you are one of these people, there are certain things which can be extremely beneficial to you, which you can do right away. They are safe and no side effects. So these are the things which I am going to narrate to you. Number one, this is called commonly as Kegel's exercise. I call this as pelvic floor muscle toning exercise. Now, Kegel's exercise or pubococcygis muscle exercise, pelvic floor muscle toning exercise is one remedy by which you can prolong the time of your sexual activity from the time of insertion of the penis into the vagina to the time of ejaculation. Sir, how do you do that? What is Kegel's? And I mean, how do I practice? How do I do this exercise? This is what I'm going to narrate to you. Listen attentively. Imagine, right now, wherever you're sitting, imagine you've got a very strong urge for defecation, for passing stools. You don't have a washroom around. What would you do? You would be clamping your anal sphincter. The anal sphincter, the bottom, from where the stools pass, you will be clamping that so that the stools don't come out and don't soil your clothes. This contraction of the anal sphincter and then relaxation. Contraction, relaxation. Contraction, relaxation of the anal sphincter, the passage from where the stools are passed, is pelvic floor muscle exercise. This you do about 20 times in a day, and after about 20 days, you can do twice in a day. Gradually, you can increase the time. This is pelvic floor muscle exercise. The pelvic floor, between your chest and your belly, there is a diaphragm. So I will not know where it was. Okay. I'll exactly not know कि कहाँ phone का ring बजा. So I'll start from one topic. I'll tell you now how. Okay. Give me a clap and I'll begin. If somebody wants to know how to prolong the time from the moment of insertion to the time of ejaculation, when the discharge spurts out, then here are certain useful tips which you can take away from this talk. One is called as Kegel's exercise. It is also known as, we call it as pelvic floor toning exercise. It is also called as pubococcygis muscle exercise. What is pelvic floor muscle toning exercise? How is it done? How do I do this exercise? Listen to this attentively. I am narrating to you the process in which Kegel's exercise or the pubococcygis muscle exercise is to be done. You are sitting at a place. Imagine that you have a sudden urge for defecation, for passing stools. You have got a strong urge to pass stools, but there is no washroom around. So what do? You contract the anal sphincter, you contract the anal passage, you contract the place from where the stools are likely to come out, so that you don't soil your clothes and that. So this contraction of the anal sphincter and relaxation, contraction and relaxation, is pelvic floor muscle toning exercise. This you can do 20 times in a day, and after about 20 days you can do it twice in a day. You can do it sitting, you can do it standing, you can do wherever you are. Pelvic floor has an important role, and how I'll explain you. This is the chest, and below that is the belly, the stomach, the abdomen. Between the two is the diaphragm. Above the diaphragm in the chest are the heart and the lungs. Below are the whole intestines. Now, do you know that below the abdomen there is another diaphragm? It is called as the pelvic floor. There's one passage from where the urinary opening comes out. There's another passage in the guy from where the anal opening comes out. The passage for passing stools. And in the woman, there's a passage for the vagina, from where the menses come out, from where the sexual intercourse So these are the openings in the pelvic floor. What you are narrating or what you're telling or what you're complaining is that you come quickly, that you ejaculate very soon. Now this you are mentioning about the penis, that how soon the penis comes into a discharge. What I am telling you is the pelvic floor, which forms the background. It's like an orchestra. You are watching your favorite singer, Kumar Sanu, Kishore Kumar, whoever. You're watching the singer sing, but you are not aware of the entire orchestra of 50 plus people who are playing musical instruments in harmony, which is enhancing the entire effect of the music video that you are watching and the audio that you're listening. So there are no voluntary muscles in the penis. So there is no exercise for the penile tissue. The exercise is the pelvic floor muscle toning exercise, the pelvic floor muscle contraction, or the Kegel exercise as it is commonly known. This is one thing that you can practice, and you will find that your ejaculation becomes little delayed, and some people can delay to a very, very significant extent and be totally satisfied. What else can you do? There's another thing that you can do, which is commonly called as a stop and start technique. What does that mean? Imagine now I'm narrating to you the procedure for the stop and start technique, which you can use so that you practice this, and thereby your ejaculation when you're doing sexual intercourse gets delayed. The stop and start technique is done this way. You are in your privacy, you are in a sexual arousal, state of sexual arousal. Now, suppose you are massaging your penis, you get an intense sense of excitement. And when the sense of excitement increases beyond a certain plateau, there comes a phase when you are sure that the spilling is going to happen. There is going to be spurting out of the semen. This point is called as the point of ejaculatory inevitability. The point of ejaculatory inevitability. Recognize this point, and before you arrive at this point during your massaging, before you arrive at this point, stop. Stop the massage. Focus on your breathing. 1, 2, your breathing. Count your breath. Count 10 breaths. After that, come back to and begin your massaging. Again, you will notice that there is a time when this point of ejaculatory inevitability will come. Stop. Divert your attention. Focus on your breathing. Count the number of breaths. In, out. In, out. Count 10 times. In this similar fashion, stop for 3 times. And after 3 times, then let the ejaculation happen. So what you have done? Actually, you are training the penis to delay at a later time. So you are training the penis not to discharge quickly, stop, and then the entire penis reflex. You are altering in a manner in which the discharge gets delayed. The discharge doesn't happen soon. This is the stop and start technique. Lots of people benefit through practicing this technique diligently. Please understand the previous exercise that I mentioned and the stop and start technique that I mentioned do not give instantaneous result. Like if done today and tomorrow your premature ejaculation is gone. No. You may have to do it for about 3 months. But you are a young guy, whatever age you are young in mind, sexually aroused. So if you do this diligently for about say 3 months, or if you just keep a practice of doing it, then you are bound to have an ejaculation which is delayed, which brings you to your goal of satisfaction. And there's something more that I can tell you. This is a very simple thing. and that is, why does somebody come so soon? Why does somebody come so fast? Simple, your sexual excitement is very high. Imagine you are hungry for 3 days, and imagine that I'm inviting you to a party where your favorite dish, imagine it's a sweet dish called the rasgulla. Rasgulla is being served. That's your favorite dish. Now, please note that you are hungry for 3 days, you have not had anything to eat, and you are starving. The moment the serving begins, you have finished 3 dishes, fourth dish, 10th dish. People are just assembling, they've just started coming. Even the whole all of them have not yet arrived. Serving all of them is not yet over, but you have already finished about 20 dishes. Why do you do this quickly? Because you're starved. In a similar way, when your sexual appetite is very high, when your sexual excitement is very high, it is very, very common that you come very soon. So, what do the doctors advise? I am giving you the same example of rasgulla, your favorite, imagine whichever your favorite dish is. Imagine I give this to you for the breakfast, for the lunch, and for the dinner every day for 1 month. Are you going to eat as quickly, as fast as you did when you were hungry for 3 days? No. You will eat it at leisure and it will stay there for about an hour before you consume all those many rasgullas. In a similar way, we are going to use this principle. What you got to do is that do sex a subsequent attempt. Suppose you have done sexual intercourse the first time and you come quickly with your girlfriend, then wait for a certain time, because this is called as the refractory phase. After a man ejaculates, his penis again from the erect state comes back to a flaccid state, and he cannot get an erection immediately. There is a certain amount of time that is passed where he will not immediately get back his erection. This is called as refractory phase. So wait for a certain amount of time, and after that time you will get a second erection. So when you get a second erection, you can do a sexual intercourse the second time. Similarly, you can do a sexual intercourse the third time. So suppose you have done sexual activity now and it is very quick and fast. You can do sexual intercourse after 2 hours, or you can do, if you have sexual activity in the evening, you can do repeat sexual activity in the morning. So the more frequent you do, suppose you are habituated to doing sexual activity twice in a month or once in a fortnight or once in a week, then why don't you do it daily? So you can do it daily, and so doing it daily is also, so that increases your frequency, so your level of excitement goes a little down and your duration automatically prolongs. There are some people who have, the patients who have confided this in us. They have said that I masturbate before I do sexual intercourse. So what they are doing, they are lowering their sexual excitement, and so they can last a little longer. So the method that I told you is increase the frequency of your sexual activity. So this is another method. I have told you about the pelvic floor muscle contraction or toning exercises. I have told you about the stop and start technique. I have also suggested that you increase the frequency of your sexual activity. And there's another thing which is an option, which is best left to the experts, the doctors. These are medicines. There are SSRIs, selective serotonin reuptake inhibitors. This is a group of medicines. This medicine, one of the medicines in 2014, this medicine was chosen or approved by the FDA for treatment of premature ejaculation. This medicine is called as dapagliflozin, that is its pharmacological name. And there are other selective serotonin reuptake inhibitors which the doctor might choose to use instead of depoxetin. Please understand that you should not be going to the medicine or the chemist or the pharmacist and purchasing medicine on your own. Self-medication is not recommended. It is strongly, I advise you to avoid taking any medicine by yourself for prolongation of your sexual time or for treatment of premature ejaculation. Leave the choice of medicine to the competent doctor. There is fifth part, which is one of the most significant topics that I want to, of all the topics, this is the most significant topic that I want to talk to you. You have come to us, or you are watching this because you believe that you want to find a solution for premature ejaculation. Why? Why do you want a treatment for premature ejaculation? Because when you ejaculate, you get orgasm, you get climax, you are done, you are relaxed from top to toe, and you're done. It's over. You are wanting to know the treatment of premature ejaculation because you want to be sure, you want to be certain that your partner, your wife or your spouse or your girlfriend is totally satisfied with the sexual activity that you do. It is true that most girls also have equal access to pornography. So the girls also may have a wrong impression about how long the sexual intercourse should last. So if a girl, like a boy, has a wrong impression that the sexual activity should last for 30 minutes or so on and so forth, then this can cause a pressure on a sensitive boy when she complains to him saying that you are not good enough, and he is collapsed. So a wrong notion about the normal time can be in the girls also, can be in the boys also. So knowing the normal time is important. Now, what you have come for the treatment of for premature ejaculation is so that the female, the partner, should be satisfied. Now, this is an important topic on which right now I am not going to elaborate in detail, but let me tell you something very significant, something very, very mature and very intelligent. We have got 4 chapters only on female satisfaction on our website, MyDoctorTells.com. MyDoctor TELLS DoctorTells.com. So MyDoctorTells.com has 4 chapters on female satisfaction. So those people who have premature ejaculation or who have any other sexual, who believe they have any other sexual, those guys who believe they have any other sexual difficulty, maybe it is erectile dysfunction or premature ejaculation, and they are keen that they want to give full satisfaction to their female partner, please go ahead. Your doctor is next to you on your screen. Open your laptop or open your mobile phone. Go to MyDoctorTells.com. Look for female satisfaction. This covers broad, important aspects of treatment of premature ejaculation. All the best to you. Get back to us with comments. See you soon with another topic.